January of 2019, Guthrie committed to making a significant investment in Cortland Regional Medical Center. Today, 2.5 years later, we gather to celebrate the completion of the Renzi Cancer Center at Guthrie Cortland Medical Center.
Cancer care was the first medical service that we recognized was needed in this community urgently. So we looked at a lot of other opportunities, but really cancer care stood out as something that the patients, the community wanted to have locally. They wanted to have it in a fashion that was coordinated, integrated is the word we use often, and that it was convenient for them. It was right here in their community. So today, we're really pleased to have this new facility and this new set of services, integrated cancer care, medical oncology, radiation oncology with a state-of-the-art linear accelerator, and all of the ancillary services that go with patients who need their cancer care treatments.
We have many patients who 10 miles is a hardship to go. And we're not talking about just coming for a surgery or a procedure and then taking some medicines and seeing that primary care physician. We have people who are having to make 30, 40 trips for their radiation oncology, people whose ongoing cancer treatment may stretch out months or even years. And for those people to have to come back and forth any further than a place like this in their own community really may degrade the ability to give them great care. Cancer is a special disease, and while each medical specialty will say that, I would challenge you to speak with someone who has a new diagnosis of cancer as opposed to someone with a new diagnosis of heart disease or anything else. You know, most other diseases, there's a vision that there's much to do and that things can be okay, but as soon as you tell someone they have cancer, it's a gut punch. And even those with early stages have major uncertainties about where they're going. A facility like this is going to make a huge difference for that.
The Renzi Cancer Center will be a legacy for all those who helped us surpass our goal. The ultimate goal and what we finally raised was over $2.75 million, which will be used to support cancer care in our community.
It's been my privilege to be a participant together with hundreds of other people in providing financial support for this project. The literature describing the project oftentimes referred to the slogan of "Forward Together." The shared values of everyone involved in this project has demonstrated the success that is possible when we move forward together.
Welcome to the Renzi Cancer Center. This is our central check-in point. We have 3 check-in stations, one to come in and stand and check in really quickly with the staff. The other 2 have wheelchair capability, so you can pull right up to it, sign any documents that need to be signed, and get your ID bracelet up here when you check in. Over here on the right of our check-in station is our shared waiting area. Our waiting area is divided into 2 sections, one for a quiet space where you can read or just meditate, and the other side has a TV so that any patient who needs to have some entertainment while you wait, you have that capability as well. From the main hallway of our waiting area is our radiation suite.
All right, well, welcome to the variant room at the Renzi Cancer Center. It is my pleasure to introduce you to this technology that we can use for the betterment of our patients that we're treating here at the Renzi Cancer Center. This is the machine here. Patient lays on the table, and then we can use our imaging device to take an image of them. This gives us the ability to understand where their tumor is on the day of the treatment so that we may align to it. So we can bring the imaging panels out. We have both kilovoltage X-ray, which gives us a CT scan, and then we have megavoltage imaging as well to look at the treatment beam. Once the imaging is complete, we will go ahead and pull these panels back. Then when the patient is aligned, the radiation delivery comes from the head of the machine up here. Radiation travels through something called a multi-leaf collimator. This multi-leaf collimator is one of the main components of the system that allows us to adapt the treatment to an individual patient. This essentially shapes the radiation beam as it's exiting the linear accelerator and entering the patient. Now, as the patient is being treated, the entire machine will be rotating around the patient like this. It depends on the case of exactly what angles we're using and what type of radiation we are delivering. But this allows us, by treating at multiple angles and using our multi-leaf collimator to customize the shape from any given angle, it allows us to customize a treatment for each and every patient and give them the best treatment that we can deliver. One of the advantages of this particular machine is it's a very high precision unit. The position of the patient on this couch is adjustable with sub-millimeter precision. The delivery of the radiation beam is also sub-millimeter precise, so we can use this accelerator for advanced procedures, for example, stereotactic radiosurgery in the brain, which is a technique used to target very small lesions in the brain. This is typically metastatic brain cancer, or metastatic cancer to the brain, excuse me. So for a treatment like that, for example, we can deliver that high technology type treatment right here in Portland. No need to travel to a bigger city because we can give our patients this high technology right here.
Once a week, patients receiving radiation will get seen by the radiation oncologist, and they will be escorted through what we call a patient access hallway. On this side, right at the entrance, is our first radiation exam room. This room is big enough to also double as our bone marrow biopsy room, where occasionally medical oncologists will complete bone marrow procedures if a patient needs it. We have 2 phlebotomy rooms. The phlebotomy rooms are connected to a bathroom for easy, convenient access to drop off urine specimen. All rooms are equipped with an infusion chair and everything that the phlebotomist would need to complete the procedure safely and in a calm space for the patient. We're now going through an exam room into our shared workspace. In this space, we have enough space for a nutrition station, which will house a refrigerator and some snacks for our patients in case they have a hypoglycemic event, or if somebody gets woozy after a blood draw, we'll make sure that they're taken care of. This is our shared workspace. In this space will be our medical assistants, the office nurse, the social worker, and the patient financial advocate. There are, if you notice in this space, entryway into all of our exam rooms. The providers will be able to come in this way to be able to go into each room when they need to see a patient. Over here on our right is a status board that staff will be able to use to see as patients arrive. Now we're entering into the infusion center. This is where most of our patients will receive their chemotherapy and biotherapy as well as antibiotic infusions. The infusion center has a patient bathroom on either end. And if you walk this way, you'll see our infusion bays. We have 8 infusion bays along this wall. This is a rendition of what patients will see on the outside when we get closer to springtime. Our infusion centers have been changed to accommodate privacy for our patients. Our current setup has a community center. Here, each patient will have their own private infusion bay. Right there is our infusion chair. We're missing an IV pole, but there's a TV for the patient's entertainment, a computer for nurses to complete their documentation, and all of the things that a patient would need while they are here. They can address the nurse with the pillow speakers. They can control the TV and also the lights. Because of COVID, we found it necessary to also have a negative pressure room so that patients with infectious disease can receive treatment here in the infusion center. When COVID started, we found that we needed to be able to administer chemotherapy and other medications to patients to meet the needs of the patient. This room is completely isolated, and a patient can be brought in directly from the outside when there's a planned visit. Over here in the heart of the infusion center is the nurses station. We have 4 infusion nurses, and our nurses work very closely with our patients to make sure all of their needs are taken care of. In our current setup in the hospital, the pharmacy is in the basement, and our pharmacists make about 20 to 30 trips per day, depending on the number of patients, to deliver our medications. In our new center, pharmacy will be immediately adjacent to us. We have 4 chemo-trained pharmacists who will be available for chemotherapy education and for all reconstitution and medication mixing for our patients. Over here, right in front of the radiation suite, is our donor recognition wall. The sculpture here recognizes all of our generous donors who gave to this amazing project. We are very, very grateful for their contribution and the contribution of this community.
Keeping our community healthy and safe takes serious commitment. So now with this latest investment and the generosity of so many, we are here to ensure our local cancer patients will have comprehensive care close to home.
I feel really comfortable that this community wanted us here and we wanted to be here. And that's the thank you that we owe all of you for the work you've done to make this happen. It's going to be a great center for your community, for your patients, your friends, your family. It's going to be here for years to come.
It is my dream that 30 or 40 years from now, maybe we'll have to turn this into a disco or something like that. That we'll find enough answers maybe that we won't need cancer centers anymore, but by God, we sure need them right now. There's a much stronger sense in that cancer center that this is more than just, it's my job, I'm going to give you your treatments and you're going to go. This is about staff who truly care that they're giving the very best of everything of themselves to the patients. So Mr. Renzi, you've made a great investment here. This is something that's going to really be paying dividends for a long, long time to come.
God bless America. God bless all of the people who will be getting care at the Cancer Center. And God bless all of the people working at this new facility. Thank you very much.